Hi, I'm Dr. Kim Shepard with Align Family Wellness Chiropractic and Acupuncture. Today we're going to be talking about reflux, especially in babies and young infants. So what is reflux? I know a lot of people get confused of the definition. So the definition of gastroesophageal reflux is the upward movement of stomach content, including acid, into the esophagus and sometimes into the mouth, most commonly after a meal. So when the spit up actually increases in frequency and severity and is also associated with colic and other digestive issues, then it's actually called GERD, which is gastroesophageal reflux disease. So those are the true definitions of reflux. But what are some of the symptoms of reflux? I have a lot of moms that come into my office and they're like, my baby's refluxing. And I'm like, okay, well, what does that mean? So some symptoms of reflux are spit up. So we have to kind of talk about what is normal spit up and what's not normal. So obviously projectile vomiting, large amounts of formula or breast milk coming up out of the mouth is actually abnormal. So a little amount of trickle coming out of their mouth or about a tablespoon of spit up after a meal or after you birth them is okay. That's not abnormal. It's when we're losing large amounts of what we just fed baby back up that we get concerned. A lot of times we'll see babies who arch their back and they'll lean back and arch their back like during their feeds or right after feeding. Sometimes they arch their backs just a lot, like putting them into a car seat or trying to lay them on their back. They get really uncomfortable and arch their back. Colic is also a symptom of reflux. So if you've not seen our colic video, go back and watch that. But colic is basically when you are crying for more than 3 hours per day. So when we're that fussy, when we have a lot of colic and reflux go hand in hand. A lot of the babies that I see, they're spitting up, they're having a lot of digestive issues. They're just crying all the time. They're really unhappy. We also see a lot of gagging. They're getting spit up that's coming up, and so they're gagging a lot. They get hiccups after they've spit up or after they've eaten, or they just don't swallow right during feeding. Sometimes that can actually be a symptom of reflux. Being irritable or unsettled after eating can be a sign of actual reflux. And then just like poor eating, not eating well, not finishing bottles, refusal to eat. We have poor weight gain. And so all of that can contribute to reflux because they're uncomfortable and they're hurting down their esophagus. And then once again, we talked about the forceful or frequent vomiting of the actual projectile vomiting. And so what we see, a lot of times what I see in my office is that babies are taking in so much air. They're just gulping, and then we're taking in all this air. And so then we have the air sitting, and then we're taking in milk on top of that. And then like if you've ever had an upset stomach or you feel like your stomach's full, and then you put milk on top of it, then it all just comes back up. So some causes, what are causes of reflux? Well, we have seen some food allergy or intolerances or intolerances to certain formulas that can actually cause the baby to be uncomfortable and spit up because they're just not digesting the formula or the breast milk well. So what I see a lot in my office is the tongue tie and the lip tie, and we're going to do a whole thing on tongue and lip tie. But what happens when you've got a tongue or a lip tie is you're not getting a good latch, and then that's when that air starts seeping in, and then when we get air, we get pressure, and then we get the reflux back up. Someone who's qualified to look at that tongue or lip tie, obviously I do that in my office, a lactation consultant. A lot of times pediatricians don't really know what to look for and often miss the tongue and lip ties. A pediatric dentist is a really, really good resource. So we have a lot of resources in our office and a lot of people that we can reach out, but we would be happy to take a look at that too. But then we also have some structural issues of reflux. So there's a muscle that is the lower esophageal sphincter, and that acts kind of as a valve between the esophagus and the stomach. So when the baby swallows, this sphincter relaxes and allows food to pass through the stomach, but it normally remains closed. So if that sphincter isn't fully developed, and so when swallowing and not swallowing isn't synced with the opening and closing, the contents of the stomach come back up into the esophagus and into the mouth. So, we want to eat, swallow, that sphincter closes and doesn't allow anything to come back up. But a lot of times it stays kind of flaccid and loose, and then all the contents start coming back up. We see that a lot with like laying babies down right away. That sphincter there's a lot of sloshing around going on of the milk in their bellies, and it's kind of up and down, and then all of a sudden it comes back up. So that sphincter gets a little bit relaxed, and then over time the sphincter gets stronger. But we also see a lot of neurological stuff happening. And so what I mean by that is a cascade of things happen for babies when they are sucking and swallowing. And so their brain has to do a lot of things at one time. So let's talk through that. So they have to steadily breathe. They have to pace the amount of breast milk or formula that they're taking in. They have to position their neck, their lips, their mouth, and their tongue all at the same time. So this beautiful balance is what it takes to have a good latch and for the baby to really take in a good milk supply from mom or from the bottle. So what happens if these systems and their functions aren't in sync together, then we get something called dysautonomia. And you guys have heard me talk about this before, so that's on other videos. But this basically means that the autonomic nervous system is having trouble with their eating, digesting, moving, and breathing all at one time. It's just kind of dysregulated. So usually we find that there is stuck stress in this infant spine. A lot of times it can come from birth trauma. It can come from, mom having just issues during pregnancy, malposition during pregnancy, that we get the stuck stress in the baby's spine. So when this is the case, when it's a neurological issue, the babies will struggle to eat comfortably and to keep food down because the nervous system wants to prioritize breathing and moving instead of digestion. So it just kind of throws the whole balance off. So a lot of treatment, traditional treatment are things such as, burping the baby more often during their bottles or their nursing. You want to keep them upright for about 30 minutes after feeding, changing the size of the nipple so that it's not the nipple on the bottle, so that, it's too much isn't coming out at one time. Smaller, more frequent feedings. Sometimes we have mom, hand express a little bit first so that there's not such a letdown in a baby's mouth. There can be sensitivities to the formula. We've seen that a lot too, where, they're just having some trouble digesting some of the chemicals and ingredients in there. And so we also have mom do some things with their food intake to making sure we're not upsetting baby's belly. But most of the moms that make it to me have already tried all of this. So, they're well-versed, they've looked at everything on the internet, and they've already tried that, and they're still looking for answers. So my job as a pediatric chiropractor is we assess and we measure the stress on the baby's nervous system, and we use our insight scans for that. We have lots of videos on our insight scans. We also take a thorough history. We go back through and we talk through the birth. We talk through mom's pregnancy. We examine the baby. We kind of figure out what's going on. We compare that to our insight scans, which can tell us where the stuck stress is in the spine. And we can then correlate that and say, here's where the problem is. And if we start working on baby and we start adjusting these spots, baby's going to feel much, much better. So, we look for the root cause and we help the baby get better because we're unwinding and we're releasing the stress in that baby's body from their birth trauma, from the pregnancy. And we use such safe, gentle adjustments that a lot of times babies sleep through it, or they don't even know that they're being adjusted because it's so gentle. So if your baby is struggling and you've tried all the things and you don't know what else to do, give our office a call. We would love to scan your baby and figure out, where the stuck stress is in their spine. We would love to take care of them and help them feel better so that you can feel better and not worry about your little one. So you can reach us here on Facebook, you can reach us on Instagram, or give our office a call. We would love to take care of your little one. But if you know someone who's struggling or another mama who's struggling, please share this video. Please share this video with them. We'd be more than happy to help them and get your little one back on track. So thanks for listening.